Hey, what's going on, guys? And welcome to this episode of the Silencing Podcast. It's your host, Adam Tatunji, back at you guys again for another episode. And today I am sitting with my man, Aaron. Aaron, what's going on, brother? Nice mic, by the way. Welcome to the show.
Thanks, Adam. I appreciate it. Glad to be here, and glad to sit down and talk with you.
Yes, yes, yes. It's exciting stuff, man. So tell me a little bit about yourself. Kind of give us back a little bit of a rundown so we can get the audience acquainted with who you are, so they know that you know what you're talking about, and then we'll get started.
Yeah. So I've got about 20 years in the industry. Started out in the military, the Army. Ran signal equipment there. I did everything under the sun because my MOS was essentially sort of kind of phased out. So I did everything from line of sight radios to old like World War II phone switching to messing with Cisco routers and et cetera, right? Even SATCOMs. Transitioned out of the military. Found it, at least at that time, really hard to get in the job market because I had a lot of experience, but I didn't have a piece of paper that kind of said I know what I was doing. Went to school. While I was going to school, ended up landing a gig working for the late Paul Allen on his estate on Mercer Island, taking care of all technology there. It bridged into the healthcare sector, and mind you, this is the very abridged version. Broken into the healthcare sector, and I've pretty much been there ever since. So,
Wow,
yeah,
really cool. So, in the healthcare space, I feel like security is a big deal, right? Because you're protecting people's very sensitive information.
yeah,
Yeah.
100%.
So,
And healthcare records. Sorry to interrupt. Healthcare records.
no, good.
Those can range anywhere from a dollar and a half to $8 a record, and when you multiply that across hundreds of thousands of records, that's that's a lot of money in records that a threat actor can sell to you know sustain themselves, continue attacks.
So you're telling me people sell health records? That's a thing. There's a market for that.
Oh, 100%. And it's not necessarily so here's the thing. It's not about like what conditions you have. The key thing for health records is your social security number, your date of birth. Because what do your health records have in them? Uh, all of your records across every hospital, every clinic you've ever been to. The things they verify: your address, your date of birth, social security number sometimes, all the important bits of data that I would need as a threat actor to go out and take out loans in your name or open up credit cards, buy crap on the internet, insert reason here. So yeah, that's why they are valuable. And a lot of threat actors view the healthcare space as a soft target.
Soft target?
Soft target.
Why?
Easy pickings.
Really? Why is that?
Uh, there's a number of reasons behind that. But the simplest is um, historically, it's been fairly easy to breach healthcare entities. One, because layer zero, right? The humans at the other end of the hello dog, the humans at the other end of the computer, they're busy. They're not necessarily watching what they're doing. It's easy to send them an email, get them to click on a link, et cetera. There's your in, right? But also, sometimes, especially the smaller entities, smaller organizations, they don't have the large security infrastructure that you would see at like a major hospital chain.
Interesting. And like, so what are the things that these healthcare companies are lacking? Like, why is this not a big talk? I mean, I feel like healthcare should be the number one most important thing is security for them.
Well, in the same context, you would think public infrastructure, power, water. Was it just last year there was a major hack on a municipal water organization. And the attackers basically got into the point. No, maybe it wasn't last year. Maybe it was a couple of years ago. But anyway, point is the attackers were able to get to a point in the infrastructure where they could control the amount of chemicals in the water. And they actually slowly started adjusting those chemicals. And that's when I got caught. So yeah, I mean, there's a lot of reasons, and I can't necessarily comment on, why this organization, differs from another organization. It just, yeah.
So, what are the most like conceptions, or maybe the most overlooked things in security when it comes to healthcare companies, from your perspective?
I don't think it's necessarily a healthcare company thing in general. I think it's just the security space in general, right? So there's a billion products out there that all kind of they all do one thing or they all do many things, and sometimes the ones that do many things don't do all of them great. But there's a lot of different products out there that serve a lot of different purposes, and it can be difficult to how do I put this? It can be difficult to determine what your organizational needs are, and wrap those products into your organization. So actually, I want a better answer than that.
Okay, go ahead. All ears.
Yeah.
Take your time.
Can you ask me that question again?
Yeah. Most common misconceptions or things that are overlooked in security when it comes to healthcare companies.
Sorry, not trying to piss off my fellow colleagues. Okay, so I don't think it boils down to a misconception, right? There are a lot of products out there, and everybody kind of does things a little bit differently. It can be hard to determine what products you need for your organization, and even then, let's come back to that question actually, if we
Okay.
can.
Yeah,
I
no
don't
problem.
know how your editing workflow is going to be.
No, don't worry about
I want
it.
to think about that. I want to think about that answer
Okay.
before I go
All
down
right.
that road, because
Yeah.
I'm really tempted to say one thing, but I know it's going to be one of those things where I'm going to
I
catch
got
some
it.
heat for saying
I got it.
it.
I got it. So, do you have any like experiences that you've had of like breaches that you've experienced? Maybe not with the current company you're with, or just like previous lives that you've been a part of. That maybe you can kind of like tell us a story of how you went through it and like what you learned from it.
Yeah. So knock on wood, I have never had a breach at any of the organizations where I have managed security.
Nice.
And so that is something I pride myself on. However, when I was working for an MSP, we did have a client. It was a small client that shares a name with a big hospital chain, at least in my area.
Mm-hmm.
It was privately owned. It was not owned by that organization or anything. They just, because they were in that complex, they kind of shared the name. They were a T&M client, time and material. They were not under contract. When I onboarded with that MSP, I started digging into our clients and trying to do some audits, figure out what they need, and advise them on it. We advised this particular client multiple times that they needed to do a bunch of different things. I think they saw the price tag associated with that because they were really far behind both security and compliance side of things. And they just kind of shut down on us. Well, they stored specifically notes on a file share server in text files.
Hmm.
A threat actor was able to gain access to one of their computers that they used a shared login for, which is already a no-no. And they were able to access that file share server. I don't know what happened after the incident because we quickly cut ties with each other at that point. But yeah, I did have to submit a breach notification to HHS. And I want to say it was somewhere around like 10,000 records, give or take. But Yeah, I don't remember the exact number.
So, and then, talk to me about like the future of healthcare, right? So, like, I know new technologies like AI, all these different things that are just buzzwords that everyone's throwing around. How do you see all of that impacting, whether good or bad, the healthcare system or the healthcare industry as a whole?
Well, the AI overlords are here to stay, right? For those in the field that think, oh well, AI is just bad, right? Like, no, it's here to stay. Um, what I think is going to happen and what I hope is going to happen are two completely different things. What I think is going to happen is we're going to start to see LLMs make their way into healthcare delivery, specifically with like chat clients, right? You as a patient, contact your local provider, hospital, whatever, via an app or their website or whatever. And the whole time you think you're talking to a person, you're actually just talking to an LLM, to schedule an appointment or, uh, get some sort of test results from your record. That's where I think it's going to go. I hope it doesn't go that way. If I'm going to be brutally honest, AI has no place in healthcare. Um, it,
You said it has no place in healthcare,
no
or
place in healthcare. Well, okay, so let
explain that.
me let me retract that. So
No, don't retract it, man. This
no,
is
no,
good
no, no,
stuff.
no, no, hold on. I'm getting to that. I think AI is great if you're going to use it for like scheduling, right? Because that's a really quick thing. Hey, I'm patient XYZ. I would like an appointment on such and such date and time, right? That is great use for an LLM, right? Um, you should not be using it to parse out patient records and hand out test results. You should not be using an LLM to provide medical advice to a patient. Those are things that AI has no place in. Um, Strictly speaking, from a security and compliance matter, because what if so let's thought experiment here. I'm you. I contact your the hospital that you go to locally, right? How hard is it for me to trick the AI into thinking I'm you if I know basic information about you?
Not that hard. I don't think so.
Not that hard. So when you scale that out and we're talking
I
hundreds
see
of
what you mean.
thousands of
So you're saying
patients.
like as smart as AI is, it's kind of retarded because it doesn't have that like human to human. See, I just used the R word. Sorry, guys. PR. Oops. Um, but it's like in a sense, like it doesn't have that like human intellect of like, oh, this, even though it seems like legit information, probably isn't. Is
Yeah, well,
that what you're saying?
AI has no basis to determine if you're the real person on the other end of that chat client,
That's so interesting.
or if it's someone else.
What if the argument of like, what if like we just install so many goddamn data points that the AI just knows because it just knows?
Well,
Like,
what does it have to verify, right? Like name, date of birth, social security number, right? Like if I know all of that about you,
I guess you're
it,
right. I never.
I mean, it's the same way with tricking, a mobile provider, right, to do a SIM swap, right? I call up support and be like, hey, I'm so and so. Here's my information. I need to get the SIM card swapped. And as long as I know all of your information, I can kind of pretend to be you. More often than not, they're just going to let me go and do it for me. And now my phone is yours.
What the heck? So, in your opinion, AI is simply in health going to just be used as like a tool. Like we can't rely on it though, because you're going to need that human touch.
Correct. Yeah.
Ah,
Mostly from a security and compliance standpoint.
I get that. I do get that argument completely. Actually, you're the first person to tell me that because I never thought of it as like, yeah, the AI function may not understand whether or not something is legit if it just all looks very legit.
Yeah.
Um,
But let's talk about the cultural element too, right? Like,
yeah,
it, culturally, um, it, people people have different needs, um, and an LLM has no real basis to understand who you are or who your family is, right? So let's bring up let's bring up a scenario. Let's say you are part of a culture that uses doulas, right?
Hmm.
Um, Actually, no, let's not go down that road. Let's edit that part out because that one's a hot button topic too.
Okay. Okay, so go ahead. You're giving an example. Do you have any of the examples?
Um, no, we'll leave it there. We'll leave it there. I
Okay.
brought this up in a similar in another podcast, and there was a lot of not necessarily negative feedback there, but it became a heated discussion between multiple sides,
Mm.
and I'm not trying to do that again.
That's too funny, man. Well, no, I think the way I mean healthcare is set up, there's a lot of things to like think about that. I feel like I don't know. Do you think maybe like, where do you think healthcare are they too focused on revenue? Like, do you feel like it's just the balance isn't there? Like, they look at security as like a secondary thing, or like what's the wrong? Is it just a wrong mindset approach, or what are they doing?
So in healthcare,
Mm,
profit margins are generally razor thin. And there's a lot at play here, but I'll boil it down to kind of two different things. One, Medicaid, Medicare. They only pay a certain amount per patient. So hospitals are incentivized to spend the least amount possible. Number two, insurance companies. Insurance companies, again, only want to spend X amount per patient. And they have different plans, gold, platinum, whatever, right? And you'll see levels of care change with both the insurance provider and the plan, which is kind of sad to see, to be honest. But again, insurance companies don't want to shell out more than they have to for patient care. So you have these competing interests between the federal government, health, insurance providers, and healthcare entities. So, let's say, just for the sake of argument and keep round numbers, let's say per patient, hospital profits are 2% per patient. Multiply that out, right? If you see 100,000 patients daily, right, and you multiply that out across the month, you're not making a lot of money. And when your SIM platform costs you anywhere between $40,000 and $60,000 a year, your Cisco licensing, aka the Cisco tax, costs you an arm and a leg too. What do you have left to progress, to move forward, to add more to your infrastructure?
mm,
So even smaller entities, you're looking at for robust infrastructure, probably somewhere between 500,000 to $1 million a year in operational costs. If you're a multi-region or multi-state hospital chain, what do those costs look like, right? So that's really the basis of it, at least from what I see. There is likely a lot more involved in that, but just pseudo outsider looking in, that that's the way I see things.
yeah, that's so I see. I feel like executives have to constantly battle with that balance. Then that must not be easy.
Yeah, and part of it, if you are a business leader, you're a CEO, right? Of this hospital. The board of directors, if you're a for-profit hospital, your shareholders, they're going to want to see profit. And if you're dipping into that profit to pay for some new whiz-bang system that you want to implement that isn't going to make you money, why would you spend the money if risk analysis is telling you don't necessarily need to?
Hmm. No, I
So
get it. Yeah, yeah, no, I get your perspective, man. I really appreciate the insight here. I'm just curious, Aaron, are you online? Where can people find you if they want to look you up? It seems like you have a lot of insights on this. I'm gonna have people maybe privately reach out to you where it's not a camera recording. We can talk a little bit more.
yeah, I'm kind of like 7-Eleven. I'm not always doing business, but I'm always open. So yeah, feel free to reach out. But I am on LinkedIn. I do post there from time to time. I was on Twitter for a hot minute, but got off of that. I did migrate over to Mastodon, but I haven't touched that account in forever.
Love it.
So yeah.
Love it. Love it. Well, hey, Aaron, thank you so much for hopping on the show, my man. I really appreciate the insights and everything you handed us here today. I think definitely walked away with some questions for me to think about for the next podcast. When everybody that's watching, if you guys enjoyed, please remember to leave a like, comment, and subscribe for more content. And we'll see you guys in the next episode. All right. Have a good day. Peace.